At MedStar Washington Hospital Center, we're all connected by our shared desire to make a difference in the lives of our patients. Our one team works together to provide our patients with the highest quality and safest care. How are you ensuring that the OR has the tools that they need to complete their procedures at the hospital?
So sterile processing goes through the process of making sure that all the instrumentation gets decontaminated and then checked and then sterilized so that it is available for surgery, to make sure that the OR has everything that they need and the doctors are ready to perform the surgery.
As infection control practitioners, we use evidence-based approaches to prevent infections that could harm staff and patients. We cultivate a culture of safety through support and guidance at all levels of the healthcare system. We do this by educating staff on protocols, monitoring compliance, fostering open communication with staff, engaging with leadership to gain support, and continuously working on our practice to protect and improve safety for patients and staff.
How is public safety ensuring that the hospital is safe and secure?
Our main responsibility is to ensure that all visitors, patients, and associates are safe. We do that in a litany of ways. We monitor the traffic, we monitor the intake, we assist patient guest services with visitors coming and going. But the most important thing that we really stress is that we always show empathy and sympathy whenever we're engaging with any visitors, patients, and associates.
Behind the scenes, many team members maintain the hospital building and keep supplies stocked and the equipment up to date so clinical staff can focus on the patients. How do you feel Biomed contributes to the overall success of the hospital?
We take care of medical equipment, we repair, we do preventive maintenance, and make sure this patient are safe and the doctor are happy.
What makes the role of the facilities department important to the hospital?
The facility department is very important because we do the upkeep of the hospital, the maintenance. You know, we keep the lights on, the water flowing, and all the devices working for patient care.
What is the role of the parking team?
They are the ones to make parking something pleasant, things that at least you don't have to stress yourself.
Then there's the frontline associates, doctors, nurses, advanced practice providers, and other clinical teams that support each other to provide the best treatment plan so patients can fully recover.
As my role as a discharge tech, I ensure the patient has everything they need before they go home, their belongings from security sometimes, and I ensure they have the medications from MedStar Pharmacy.
As a nurse, I do believe it takes everyone in the hospital for it to function appropriately. Like, it would not be where we are today, it wouldn't be a one-team approach without all the different departments here, and that's anywhere from EVS to nursing to the providers to case managers, literally everybody. The communication, everything ties together, and wouldn't be a functional, great hospital striving for the best if it wasn't for all those departments.
How are you advocating for patients in your role with patient experience?
I would say I advocate for patients by being a diligent representative, making sure that they feel heard, supported, and also making sure that not only are the nurses and techs aware, but any other advocate part, such as a team or other specialists, or how the patients feel, and double backing, making sure that any issue or concern is resolved.
How does your role as a surgical resident contribute to MedStar Washington Hospital Center?
Right now I'm headed to go do a dressing change for one of our patients. So we do a lot of hands-on work every day, but we also are involved in planning and management for, what is the best thing that we can do to help our patients, hopefully leave the hospital or just kind of go on their way with their health journey.
As a hematologist-oncologist, I think my role would support the hospital by providing my medical expertise, by diagnosing, very complex patients, collaborating with other healthcare professionals in and outside of the MedStar system, and contributing, to the overall health and well-being of the community, which is, served by the hospital.
It's clear that no team works alone here, and that every department is connected. This week and every day, we celebrate the heartbeat of MedStar Washington Hospital Center, our associates. Thank you for your daily contributions, dedication, and compassionate service. I'm Toyin with One Team News.